We see people who have chronic wounds, which we define as wounds that have been present for 30 days or longer, or that as you approach 30 days look like they're not going to heal and haven't made any progress. So these are not folks with the routine sort of lumps and bumps and scratches that most primary care or family docs can take care of, but more difficult or indolent wounds than that. And the most common types of folks we see are diabetics with chronic diabetic foot wounds, and patients that have chronic venous or arterial insufficiency.
I am a type 2 diabetic, and I had a foot ulcer that produced an open wound that I had been working on and with many doctors for about a year. And we finally got to the point where the infection went into the bone, and I ultimately wound up losing my big toe on my left foot. That got cleared up and that healed nicely, but the actual ulcer didn't heal, so we still had an open wound.
And then ultimately we do have hyperbaric oxygen chambers in the back, which are appropriate for some folks whose wounds can't be healed in any other way.
So I went over there and I met the members of the clinic, the nurses, the doctors, the technicians. They're all absolutely wonderful, the best medical care that I've ever had. I finally got approved for the HBO chamber, and basically I started that. I was their first patient to go into the chamber, and I ultimately wound up taking 60 sessions of about 3 hours each day, and which ultimately cured and healed completely the wound on my left foot. And so basically what it did was it saved my foot. If you want to get down to the bottom line, this particular treatment saved my foot.
It's just sort of approaching everyone in a comprehensive fashion. We do a lot of debridement. We do have access to some topical therapies and a few fancy things that are not available in most offices.
The nurses and doctors here are fantastic, you know, and I wouldn't have the progress that I have if I had not come here. If I stayed home and said, oh, I can do this myself, just put a bandage on it, just keep changing your bandage, you know, then they had done that, you know, down to the years. Or just kept going to the doctor and get pain medication and ointment, you know, it wouldn't have healed properly. They wouldn't have found that I needed to have the debridement. I needed the bone to be taken out. I was saying, oh, it's going to heal, you know. And like a lot of people, you wind up losing your legs. You don't have to.
We try not to miss anything. So everything from the patient's nutritional status to the control of their diabetes, their arterial and venous anatomy, all of those things get assessed every patient every time so that nothing falls through the cracks.
I'm still here. I'm still here. I still have both my legs. They might not be as pretty as the next person. They're strong, you know, and I'm strong. This whole situation has made me a strong person.